Very much, Mr. Speaker. It is a pleasure to speak in support of this bill. And as Dr Hutchison alluded to, it appears that all parties will support the third reading of this bill. But I would just like to address the concern that Dr Hutchison raised about some of the material that the opposition is covering and why we have spoken so forthrightly against some of the myths that the government is creating about the health system. Because the Minister and Dr Hutchison both spoke at length about value for money and about productivity. And indeed, this bill does support shared procurement and is an attempt at reducing costs in the health system. And it's a good thing. It has noble objectives, and the opposition does support it. However, it is based on a premise. And indeed, all the government's spin and Dr Hutchison's speech and the Minister's speech are all based on this premise that New Zealand's public health system costs too much, has too much bureaucracy, is inefficient and unresponsive. Well, Mr. Speaker, as much as we support any moves to make it more responsive, to make it more efficient, we must dispel this ridiculous myth that the government is espousing. Mr. Speaker, in my second reading speech on this bill, I offered up the amount of money that is spent per capita on health in New Zealand as a way of measuring how New Zealand ranks internationally in terms of the total cost of healthcare. And New Zealand ranks very well by that measure, spending less per capita than Australia, the United Kingdom, Canada, Germany, and of course the United States of America, where costs really have blown out due to that country's total reliance on private providers and multinational health insurance and the influence of the lobbyists from the pharmaceutical industry. That is a country that needs to take a serious account of cost blowout in the healthcare system. But there are a number of other measures by which we might look at how New Zealand compares internationally. Life expectancy is one. Not only do we compare very, very well by life expectancy, but when we measure life expectancy against how much we spend per person, then we do even better. The cost of purchasing pharmaceuticals, New Zealand just about outranks every other country in the world on that one, thanks to Pharmac. The use of technology and information technology is another area where we do very, very well internationally, and I bet most people in New Zealand will be surprised by this one. Satisfaction rates amongst primary care physicians in New Zealand are absolutely astronomical in comparison to many overseas jurisdictions. Mr. Speaker, the New Zealand health system does very, very well, and yet this government seems to insist on pushing the message, and it does so through this bill, that it basically has built a burning platform, that the healthcare system is in absolute crisis, and yet when you actually look at it in real terms, Mr. Speaker, there is a lot good to be said about our health system, but there are places where we can improve. And this is where my friend Mr. Woodhouse is getting a little bit concerned. Don't worry, I'm getting there. There are areas where we can improve. But this bill, Mr. Speaker, is just tinkering. This is small stuff, because the real savings in healthcare are to be found in tackling the really big issues, the things that really cost our system. Diabetes is one area where we do appallingly internationally. Youth suicide is actually probably one of our biggest shames internationally. Cardiovascular disease, diseases related to alcohol abuse, tobacco use, and other drug abuse. All of these are the things that really cost our system. And if the government was serious about cutting costs, it wouldn't be dilly-dallying with this bill. It would have a serious strategy to take on those things, a strategy for wellness in New Zealand. All of those issues affect those who are most deprived in a far more destructive way than those who are least deprived. So the single biggest thing this government could do, if it was serious about reducing costs in the health system, would be to have a serious strategy to reduce inequalities. What have we actually seen? We have seen tax cuts that increase inequalities. We have seen an increase on GST that affects those who spend the majority of their income on the basics in a far greater and more destructive way than those who have more disposable income. This government is actively increasing those disparities and is undermining the good work that our physicians, our nurses, our specialists are trying to do to clean up the mess left at the bottom of the cliff. This government has no strategy for prevention. It doesn't care for prevention. It doesn't care for reducing inequalities. And we can see this in the jack-up of the Horn Report. The Horn Report does begrudgingly mention the strategies that the previous government had for prevention and the effect that they have had. It says New Zealand's relatively strong commitment to prevention and public health has helped improve life expectancy, delayed the onset of disability associated with chronic disease and reduced inequalities, Mr. Speaker. 9 years of Labour, and the Horn Report had to admit that that was the outcome that came from the strategies that the Labour government had in place. But it goes on to say this. Opinion is divided, however, on the much narrower question of the extent to which further spending in this area is at the expense of more immediate health needs and might reduce the future health costs or improve the country's economic performance, thus making health spending more affordable. A narrow focus. That's what this government is focused on. It is sleight of hand, it is smoke of mirrors. The government is not interested in the big picture. It is not interested in where our health system might get to in 2020 or 2030. It is not interested in improving outcomes for our children. It is interested in the very narrow focus of the here and now. And you know what? I'm prepared to concede, Mr. Speaker, that politically that makes some sense for the National Party, because people who habitually vote for the National Party don't tend, in tendencies here, they don't tend to suffer from social deprivation. They don't suffer from the effects of low income. They don't suffer from the diseases such as diabetes, cardiovascular disease and everything else. They certainly don't tend to suffer from rheumatic fever. So politically, a focus on the here and now and a focus on the health system's ability to respond to people who are fundamentally well makes sense for the National Party. But if it was truly interested in all people in New Zealand, if it really did have a strategy that encompassed the whole community in New Zealand, then it wouldn't be faffing around with this bill, and it wouldn't be faffing around with the kind of recommendations from the Horn Report. It would be focused on a true public health preventative strategy. And you know what, Mr. Speaker? That's what they're doing in Australia. We're very focused on the catch-up with Australia. The focus on trying to close the wage gap and to economically catch up with Australia. Government's failing abysmally on that as well. But in Australia, their big priorities are these: obesity, tobacco and alcohol. And they haven't just come up with a few bullet points and a catchy slogan. On each of those issues, they've got an overview, they've got a roadmap of how they want to get to their final goal. They have technical papers that deal with the guts, the details. They have a plan, and literally they want to know where they want to be in 2020. And that government, the Labour government in Australia, has a real strategy for encompassing everybody in the community and for wellness in the whole community. Mr. Speaker, the opposition does support this bill. We support the objectives of this bill. It certainly does no harm, and so we are happy to see it pass through. But, Mr. Speaker, there is a problem with our health system. It is not what the government is offering in terms of problems. It is how it treats those who are most deprived and most vulnerable in our community. This bill doesn't address that, and it's about time we had a government that was prepared to put something up that did.